And really with the number of these modifying therapies that have come to market, which is such an exciting and revolutionary time in treating our MS patients. And year by year we're seeing that we can not only provide treatments that are effective, but we can actually balance the safety profile of those treatments so that we put our MS patients at minimum risk. Of course, that risk still exists. A lot of the risks depend on the type or category of medication that we use. Broadly speaking, there are many different mechanisms of action for MS modifying treatments. Certain medications, for example, do suppress the immune system. Those are, belong to certain categories of medications. Some of them are oral medications that the patient take. One particular group is called S1P receptor modulators. And what those medications do specifically is they actually trap the lymphocytes in the lymph nodes and reduce the number of circulating lymphocytes. And when you think about it, if you're reducing the number of lymphocytes that are out there, and they're kind of like the policemen, that they're trying to kind of look at viruses that are around and try to guard them, if you reduce the number of those cells that are doing this very important surveillance work, that oftentimes results in opportunistic infections or viruses kind of taking advantage of that situation and causing these infections. So that's one class of medications that's been linked to this particular brain infection called progressive multifocal leukoencephalopathy. But more commonly, it actually occurs with one of the infusion medications known as natalizumab. And of course, natalizumab is a treatment that is very effective for the control of inflammatory activity in MS. And it really works through a unique mechanism. It blocks the lymphocytes from crossing the blood-brain barrier, that barrier that really interfaces with the brain and the spinal cord tissue. So it kind of acts as a bouncer where the lymphocytes don't really, are not able to enter the brain. And as a result, you get a very high effectiveness for controlling MS lesions if you're preventing the immune cells from, going to the areas where we think the autoimmune inflammation develops. But of course, the correlate to that is if there's any latent viruses within the brain, the most common in this particular context being the JC virus, there is a risk of those viruses reactivating and causing the progressive multifocal leukoencephalopathy condition, or PML for short.